It might be a little cliche, but I do think that we are a family in this family medicine department.
We've got a really close-knit relationship with our attendings, and they help foster an environment that's very fun, and then that kind of trickles down into our residents as well, from the senior residents down to the interns.
I think we have a real culture of curiosity that fosters learning. I think there's a culture that encourages us to ask questions, to learn to better our patient care and learn best practices. I think there's a real culture, too, of mentorship and teamwork between the residents that allows us to learn better and allows us to provide care in a better way.
When I was looking at residency programs, I was really interested in a well-balanced program. I wanted somewhere where I was going to get really good inpatient training as well as outpatient training. And I think that is one of the strengths of our program, is that we spend a lot of time here in the hospital, but then we also get to follow those patients up in our clinic after they're discharged.
I think we get a really good variety of patients, inpatient and outpatient. The vast majority of our patients struggle with hypertension, diabetes, heart failure. So you get a really good experience taking care of sick people, both in the outpatient setting and inpatient.
The faculty also have really diverse kind of niches of experience that I think help a lot with teaching us how to approach specific patient cases and care and workup. Some of our faculty have in-depth experience with LGBTQ health, women's health, sports medicine, and I think that really helps with us being able to see those varied patients and learn for ourselves how to best care for them. I also really like that we get to work with residents, fellows, and attendings in other specialties here. I think that was really important to me because it allows me to learn from people who do that as their specialty all the time, and they help teach you some of the workup that they do and the care that they routinely do, and it makes you better as a family practitioner.
There are a few common places that I feel like really should be showcased. I think the first is our Main Street Clinic. It's a fairly updated, renovated clinic. It's a very large space, and it helps us care for such a large patient population that we have.
We also have access to a resident lounge, which is really nice. We've got a ping pong table and this basketball setup that's kind of fun. It's nice to have a break room in there.
I also feel like our facilities here at the hospital should be highlighted, because UF Health is a very large tertiary medical center that provides great care, has extremely nice facilities.
My favorite thing about Gainesville is all of the outdoor activities that we have access to. It wasn't something that I realized initially when I got here, but I've started to discover all the different trails around, and I think that I could find a new trail every week.
It's a large enough city where you have plenty to do. There's always food trucks around, things to do on the weekends, lots of activities, but it's also small enough where you don't feel overwhelmed and cramped down in a big city, and I think that's very important.
I love the community in Gainesville. It is partially a college town, which I think definitely contributes to kind of the liveliness of the community, but there's also a diverse community that's here otherwise, that's outside the university.